For families and clinicians, trying to communicate basic personal health information can be frustrating and time-consuming.
Zionsville-based SafeKeeping says it has a business solution to bridge that communications gap, something many families face when it comes to getting important information about loved ones in long-term care facilities. How's Mom is the name of an app created by SafeKeeping to streamline communication between long-term facilities and family members. The software-as-a-service startup says business is booming, revenue growing nearly 400% this year. Business of Health reporter Kylie Valletta has more. Kylie.
Well, thank you very much, Gary. The pandemic has created incredible traction for SafeKeeping in 2020 as long-term care facilities have carried the heaviest burden of the COVID-19 crisis. Communication between those facilities and families has become more critical than ever before. 250 long-term care facilities throughout the country are already using the software, including about 50 in Indiana. Doug Wilcox is SafeKeeping's co-founder and chief executive officer. He joins me now to tell us more about the growing company. Doug, thanks for being on the show today.
Thanks for having me. I appreciate it.
All right. Well, really, your personal experience is what gave birth to SafeKeeping. Can you explain how what you went through helped give birth to this company?
Sure. So both Matt Prasek, my co-founder, and myself, we had very close relatives in extended stays in long-term care. And during that process, we found it very frustrating just to get basic health information of our loved ones. And at the same time, we recognized that it was also very frustrating for nurses and other caregivers to easily communicate that information back to family members. So we set out to develop a platform where we could better connect family with their loved ones' care data and do that in a convenient, real-time way, relevant real-time way, and to do it in the most convenient format, which is on connected devices. And that's what SafeKeeping does.
All right, so let's talk about it a little bit. So the company is called SafeKeeping. The app is How's Mom. So explain the nuts and bolts of your software and your app and really what it does.
Sure. So we have developed 2 integration partnerships with the largest electronic medical records providers in senior care. And so through that, we are already connected to all of our facilities, all of our customer facilities. So we take that information and we share it with family members, and we're really giving them new communication channels that they haven't had before, and that replaces old antiquated methods, which is numerous one-off phone calls and emails that were really time-consuming. And we do that in a couple different ways. So through SafeKeeping, our clients can now send out mass notifications and mass updates to all of their families at one time with just a couple of clicks. So it's very quick and very easy. And more importantly, we enable our clients to share personal health information with authorized family members. So things like vitals, medications, nutrition orders, other kinds of critical data, families can get in real time, whenever they want it, whenever they need it, and again, on their connected devices. So we're really helping our customers give better peace of mind and a better experience to their family members, which in the long term improves health outcomes overall.
And I know it's free. The app is free for the families to use. You mentioned the partnerships with the 2 largest electronic medical record platforms in the senior care area. Explain the significance of that, especially what it means for the facilities and their workflow.
Sure. Yeah, and it is significant and is key to what we do. So as I said before, because we're already integrated, we're already into their electronic medical records systems, what it means for our customers is that their care staff, there's no additional work, there's no duplication of entry, there's no change to processes or protocols, and there's no additional hardware or software that they have to manage. So as you said, that's very important for them because they already have staff that are being overrun with responsibilities Short staff is a big problem in the industry. And so not only are we helping families connect better with their residents, with their loved ones, but it's also a significant operational efficiency tool for our customers that they use.
We mentioned earlier, you've seen nearly 400% revenue growth this year. Obviously, the pandemic has played a big role in that. Explain what the last 8 months have been like for business for your company.
Yeah, so COVID-19, the coronavirus, has obviously had a very positive impact on our business. And starting back in late February, early March, when it really started taking hold, we were overrun with calls and requests and interest in our platform. And that was because at that time, practically overnight, these senior care facilities were required to better communicate with family members. And that's precisely what we do, and we were very well positioned for that. And so, yeah, over the last year, we've gone through this significant growth period, and we've really helped, as you said, hundreds of facilities kind of navigate this COVID environment that we're now in. And as we continue to evolve through COVID, we feel we have a really good roadmap to continue to help our customers address the needs that they have now and that they will have as COVID changes. And the other thing is we hear on a daily basis from family members who tell us that the only way that they can keep in contact now with their loved ones is through SafeKeeping because of restricted visits or no visits at all. So a lot of times SafeKeeping and the How's Mom app is the only way that family members can keep in contact with their loved ones. And that's something that we really feel good about and something that we take very seriously.
All right. Well, Doug, I especially like the name How's Mom. I think it's a great connection to what you do. Thanks for being on the show today and telling us about your growth.
Thanks for having me. Thank you very much.
Sure. Gary, back to you.